Well, I want you to call your young duty associate and get a hold of that trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy. Get a hold of one of my newest books, Epigenetics, The Death of the Genetic Theory of Disease Transmission, because I want you to begin to do your own laboratory test. When there's birthdays, anniversaries, Christmas, Easter, New Year's, 4th of July, Labor Day, these sorts of things, any holiday that you're going to have a family get-together, everybody needs to get their physical done. Have a scale there. Get blood pressure testing kits. Very simple. You can get a watch and you look at second hands and do the pulse, okay, and put all this down in a logbook for each person. And then you want to get to the pharmacy without a prescription and get a hold of all the test strips you can. Of course, the major ones are the blood test strips where you can do your own A1C hemoglobin and your blood sugar test. And in the book, Let's Play Doctor, it shows you how to do a 6-hour blood glucose test, okay, a 6-hour blood glucose test, also a fasting blood glucose test. And then you have the urine multi-sticks, which show you liver function, kidney function, heart function, all kinds of stuff going on with the urine test. And then we have, of course, the equivalents of the colonoscopic exam, which is the occult blood test, and the FIT test, fecal immunochemical test. And none of the, I shouldn't say that the occult blood test and the FIT test are not invasive. And why would you want to go to a doctor in his office and he sticks a garden hose up your rump to do a colonoscopic exam, and there's this high chance of puncturing intestines and you dying of a belly infection called peritonitis. Okay, you can do these tests yourself without any risk of this type of invasion damage. If you do this on a regular basis, you can kind of stay ahead of the curve. And, if you see, gosh, my blood sugar is starting to creep up a little bit, and I'm kind of in that metabolic syndrome or in the pre-diabetes level, you can change your diet, get on the healthy blood sugar pact and support and promote healthy blood sugar levels and support and promote healthy carbohydrate and sugar metabolism at the cellular level, and kind of drift back into the normal blood sugar levels, okay? It's a lifestyle thing. It's actually a deficiency disease. And it goes back, almost 80 years ago. Now, think about that. Almost 80 years ago, we knew that type 2 diabetes was a deficiency of a single mineral. Double-blind studies, very, very, which I say the work was done both in animals and humans, and it was done by people of very high esteem, both in government and universities, and so it's not like anybody's making this stuff up. And, of course, this is one of the bases of our healthy blood sugar packs is this work that went on almost 80 years ago, because, by golly, it works. You give the body what it needs, and it will maintain itself. Our body wants to heal itself. Our body wants to maintain itself, but you just can't do that drinking distilled water and eating well. You must supplement your genes, your DNA, your RNA, and your little caps on the end of your chromosomes, the telomeres, all require 90 essential nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. That's why these things are essential. The medical system believes falsely that your genes are autonomous. They're going to do what they're going to do regardless of what you do. In other words, they say, okay, if you have good genes, the good genes are going to do good things. If you have bad genes, the genes are going to do bad things. Well, that's not true. Okay? They require good nutrition, but not just from eating food, because you don't get enough nutrition in your food anymore. So the only way to level the playing field and reach your genetic maximum potential for health and fending off disease and longevity and strength and speed and making good decisions, things we think of as being controlled by genetics, you have to supplement with the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. Now, just think about it. Look at people like Steve, okay? And we're talking about Steve Jobs. Okay, Steve Jobs, a techie guy. Steve, dies in 56. His parents buried him. The second most powerful man in the world, Joe Biden, buried his 47-year-old son, Bo. And then Iwata's parents buried him at age 55, a billionaire CEO of Nintendo. How did this happen? Well, they're spending $1,000 per meal. They can afford the best doctors, the best health plans. What is going on here? Well, that's because they think they can get what they need from eating well. Well, what's happening here are middle-aged people in America, particularly middle-aged white people, are dying younger and younger and younger. Big study just came out, full page front story. Well, I shouldn't say it. Is a significant story on the front page of the New York Times yesterday, and today was in the Wall Street Journal, significant size story, that the middle-aged white people are dying younger and younger and younger, higher amounts. In fact, the death rate for these middle-aged white people went up 22% from last year. 22%. That's like 1 out of 5. It's like crazy. And that's because they're not getting their nutrients. You know, they say, oh, you know, and there's a lot of those are caused by drug overdoses. Well, why are they going to the doctor for prescriptions? Because they have nutritional deficiencies. And I urge you to get a hold of that trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, The Passport to Aromatherapy, and the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Take care of your family. Do your own lab tests. Do not go to doctors unless you really, really are bleeding all over the place. We'll be back with more truth, justice, and the young give away. And dead doctors don't lie for these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, you've been vindicated again. Because you've been telling people to stay away from sugary drinks for as long as I've known you, and I've got a story here from CNN headline, Could Soda Break Your Heart? Another reason to limit your intake of sugary or artificially sweetened sodas might contribute to heart failure. Researchers followed food habits of about 42,000 Swedish men over 12 years, found that those who drank at least 2 sweetened beverages a day had a 23% higher risk of going into heart failure. And this was all published in the British Medical Journal. They say that according to the co-author, Dr. Susanna Larsson of the Stockholm Karolinska Institute, says the takeaway message is that people who regularly consume sweetened beverages should consider limiting their consumption to reduce their risk of heart failure. And they go on to say, in this population-based study, men who were asked how many soft drinks or sweetened drinks they drank per day or per week, and the definition of sweetened drinks only included soft drink sodas and other sweetened with sugar or artificial sweeteners. Tea, coffee, and fruit juice were excluded from the study. Findings are likely applicable to the United States, but they say more study is needed because the study focused on Swedish men ages 45 to 79, did not include ethnic groups, women, or children. And they say prior research has shown a connection between heart disease and stroke and the consumption of sweetened beverages, but no study had looked at heart failure, for which men and the elderly are most at risk. And, of course, they say nearly 6 million people live with heart failure in the United States. As the population ages, more people survive heart attacks and live longer with high blood pressure, and numbers of people living with heart failure are rising in the United States and around the globe. They say heart failure is so serious that according to the Heart Failure Society of America, less than 50% of patients are living with 5 years after initial diagnosis, and less than 25% are alive at 10 years afterwards. In a statement from the American Beverage Association, their spokesperson said the industry is committed to providing Americans with choices and information to help them live a balanced lifestyle. So they had to do a little pushback there, but that's something that you've been talking about for a number of years, as long as I've known you. Actually, is there's really no need to drink those sweetened beverages.
Exactly right, and of course, I have to go back and look at the original study and see what they mean by heart failure. They're talking about all kinds of heart deaths. That's one meaning, but if they say heart failure, meaning congestive heart failure, we know that disease is caused by deficiency of a single vitamin. When you're deficient in that vitamin, if you take in sugar of any kind, whether it's honey or molasses or soft drinks or juices or sweet potato, anything, any source of sugar, cereals, even white bread, multi-grain breads, it doesn't matter. Those sources of sugar will make the deficiency worse because this vitamin that's missing, its whole function is to deal with the metabolism of sugars and carbohydrates by all organs, including the brain and the heart and the liver and so forth. And so if you already have heart failure due to a deficiency of that vitamin, taking in sugar, certainly from many sources, including sugary drinks, is going to push you over the edge because it accentuates, it magnifies the deficiency. And, of course, then you can't metabolize energy inside the heart or the liver or the brain or whatever else is going on here, and you will suffer egregiously, and death is a pretty egregious suffering. And so thank you so much for bringing that up. And it's one of the things Why you always have to think about the 90. You cannot eat well enough to get all 90 essential nutrients. And, of course, your heart works constantly. Where you're sleeping, it just never stops working. And so to not give your heart everything it needs, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, it's an insane line of thinking. You must give your heart everything it needs, 90 essential nutrients, and you'll add years to your life. But we'll be back with Dead Doctors Don't Lie after these messages.
Many believe that all life began in the Earth's oceans. We do know that the oceans and seas are still abundant with life and life-sustaining nutrients. Many cultures have long believed in the life-giving properties of plants and sea life harvested from the oceans. Youngevity's Ocean's Gold is a proprietary blend of seaweeds, algae, mosses, kelp, sea cucumbers, and sea minerals, as well as coenzyme Q10, calcium, and iron, all designed to help support healthy thyroid function, regular heartbeat, normal weight, mood stabilization, and hormone levels. Take advantage of life-sustaining nutrients from the Earth's oceans with Youngevity's Ocean's Gold. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Okay, Doug, let's go to callers.
All right, let's head to Idaho. And Debra, you're on with Dr. Wallach.
So, Debra, you're on the air.
Hi, Dr. Wallach. How are you today?
Fine, thank you. How can we help you?
Thank you very much. My question is, I have chickens, and I am feeding them an organic certified feed.
Okay, I missed the first. Whoa! I missed the first couple of words there. I don't know if you looked away from the phone or something. I heard muffled noise, but I didn't hear the first couple of words. So please start again.
Okay. I have chickens, and I am feeding them an organic certified feed. However, the ingredients in this order go organic wheat middlings, organic ground wheat, organic soybean meal, calcium carbonate, organic ground corn, and then a bunch of vitamins and minerals, and the last ingredient is organic soybean oil. That doesn't probably make me gluten-free, or, people wwho eat eggs from that,
yeah,
right?
The wheat and the middlings, which could be wheat bran or something like that, or wheat dust, they're probably not gluten-free.
Right. And so the point is, how can I make my own chicken feed? And probably adding the blooming minerals for the minerals, right?
Yeah, exactly. Add the
how
blooming
can I
minerals,
make
but you would need more. You'd need more calcium than that too. You'd need something like the Ultimate Cal, or another source of calcium, maybe in their drinking water. Something like the Cal Toddy. You can put an ounce of the Cal Toddy per quart of drinking water for them. And you can get a mix of non-gluten grains like rice and corn and that sort of stuff. But you're going to have to add all 90 essential nutrients to that. Otherwise, you're going to wind up with some deficiencies, and the chickens won't do well over time. Okay? So it's a little more complicated than just... What you want to do is get some... Okay, what you do is you get gluten-free chicken food. Let some factory make it based on the nutrient levels supposed to be in chicken food, but I'm sure they sell gluten-free organic chicken food. But you have to ask for it and go online and look for it, and I'm sure it's around someplace. Okay? But it doesn't hurt to add
the vitamins and minerals. Huh?
It doesn't hurt to add the blooming minerals. We have a lot of experience through that through one of our guys, call him Chicken Man, and Char knows him very well, and he has many years of data of feeding these chickens and winning all kinds of contests and using the blooming minerals for increasing egg production as well as weight gain and so forth. So they have that sort of stuff. But to be gluten-free, you're going to have to get gluten-free chicken food, and I would get chicken food that is made with the requirements of chickens in mind. Okay? Don't try and do it yourself. It probably won't work out. Well, we'll be back with more Truth, Justice, and the Longevity Way. And Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
All right, let's head to Baltimore, Maryland. And Muriel, you're on with Dr. Wallach.
Okay, Muriel, you're on the air.
Good evening, Dr. Wallach. Appreciate you taking my call. I have some type of parasite. I think it's a tapeworm. It's all over my entire body. And I've been to the hospital 6 times. They can't see nothing. And this thing is just taking over constantly. I did CAT scan.
Let's stop there for a minute. So I kind of catch up with you. How old are you, Muriel?
62.
Okay, and how long have you had the skin problem?
Let me see.
1 year, 10 years, your whole life?
No, actually, no. It just started recently, about 4 to 6 months ago.
Okay. Did you have asthma as a kid?
Yes.
Yes?
Yes.
Okay, do you have children?
No.
No? Okay. Do you have any brothers and sisters?
Yes.
Okay, do any of them have asthma?
Yes. Well,
Okay.
we all have bronchitis. My mother was
We all have chronic
asthmatic.
bronchitis and asthma. Okay. And let's see here. Anybody have, again, skin problems, brothers and sisters? Anybody have skin problems, things like dermatitis, eczema, rosacea, psoriasis?
None of my siblings, but I understand a couple of my great nephews have.
Okay, and they came from your sisters, maybe?
Their children, my nieces.
Okay. Now, have you had any bowel problems, any of your brothers and sisters or yourself? Anybody had appendicitis or constipation, diarrhea, irritable bowel syndrome, anything like that?
No.
Okay. Okay, Char, this is a Char thing. Here's Muriel. She has a history of asthma and bronchitis. All of her siblings have asthma and bronchitis. What do you think's going on here?
I know she has a gluten intolerance.
Okay, well, hang on, Muriel. We're going to be back. We're going to give you some advice on how to determine the parasites, and we'll give you a supplement program after these messages. Okay, Doug, let's go right back to Marilyn and Muriel. How much do you weigh, Muriel?
350.
250?
350.
350. Okay, how tall are you?
5'6".
5'6", okay. Well, I would say you're 200 pounds overweight. You're a big girl. If you're 5'6", you weigh 350. You're a big girl. We need to deal with that. Now, tell me about your skin. You say you have tapeworms in your skin. Tapeworms normally don't get in the skin. They're found in the intestine.
No. I said I had tapeworms. I didn't say it was in the skin. There's nothing wrong with my skin. It's in my body. Like I was saying, I've been to the emergency room 6 times, and they said that they saw a nodule on my adrenals. And then I had an echocardiogram. They said they see something in my heart, but nobody knows what it is, and nobody believes I have a parasite in my body.
Okay, well, here's an easy way to confirm whether or not you have parasites. Get a hold of the book, Let's Play Doctor, and in that book, it teaches you how to do your own stool sample, and it's very easy. You just have to have access to a microscope, which you can borrow or go into the high school or junior high school in their biology classes. They have microscopes. It take you 5 minutes, so you might be able to find one online for $25, little microscope. And the book, Let's Play Doctor, shows you how to deal with a bowel movement, a fecal exam for parasites, whether it's a one-celled critter or wormy things like tapeworms and pinworms and roundworms and so forth, hookworms. And so I'd urge you to do that because doctors don't do very well. If you don't want to get into that icky stuff, then go ahead and take maybe a couple of tablespoons of your own bowel movement, take it to a veterinarian and tell him it's from your dog. Let him run it, and he'll do a good job for $25, I think, to do a stool sample and find out if there's parasites in there. And then the book, Let's Say Herbal Doctor, will tell you what to do to deal with it if you do have parasites. Now, Char, again, this is a Char thing. This lady Muriel here, very nice lady, is 200 pounds overweight. What would you do for her for the weight problem in addition to her basic 90?
Well, I'm assuming she's probably got arthritis and carrying all that weight around. I would get her, she really needs 4, but at least three healthy bone and joint packs. And then for the parasites, I'd give her the killer biotic, and probably she could also take the Oxybody.
Okay, what would you do for her losing 200 pounds?
Oh, ASAP, of course.
Well, there you go. Okay, so here you go, Muriel. Char's exactly right. You got to get rid of all the bad stuff. Absolutely. You cannot have any fried foods, no processed meats, no oils, no gluten. In fact, I would go grain-free. No wheat, barley, rye, or oats, no rice, no corn, no millet, no buckwheat. And I would also give out no potatoes, no white potatoes, no red potatoes, no sweet potatoes. Give all that up. I want you to eat vegetables for breakfast, lunch, and dinner, except for potatoes. I want you to have eggs. I want you to have red meat and fish and poultry, but each serving of the poultry or fish or red meat has to be the size of a deck of cards. We've got to kind of watch calories here. And then also eggs, I'd go ahead and have at least 3 eggs twice a day. And then Char's exactly right. When it comes to weight loss, I'd have to get 2 bottles a month of the ASAP. You put a dropper full under your tongue 30 minutes before each meal, a dropper full under your tongue 15 minutes before each meal. So you're going to have 2 full droppers full under your tongue before each meal, one 30 minutes before the meal, and the second one 15 minutes before the meal. Leave it absorb through your oral tissues. Do not swallow it. It won't hurt you if you swallow it, but you won't get maximum benefit. And then Char's exactly right. I'd go ahead with the 3. It should be 4, she said, but I go with 3 of the healthy bone and joint pack, 3 healthy bone and joint packs, and 1 full dose of everything at breakfast, lunch, and dinner, 1 full dose of everything breakfast, lunch, and dinner. Okay, and then I would also throw in, like I say, the ASAP, and then what would you do? What would you do for this sort of anxiety, Char, that Muriel has about the parasites?
I give her the de-stress.
Very good, perfect. You get an A+. I give her the de-stress. Muriel, absolutely, you want to take 3 of those 3 times a day. That's 3 bottles a month of de-stress. That gives you the supplements you need for your brain, your heart, your liver, everything to be working from a standpoint of metabolism very well. And then once you get your stool sample done, and if there are parasites, why not give us a call, and we'll walk you through it. But again, you can get the book, Let's Say Herbal Doctor, and it'll tell you what to do depending on what kind of parasites you have. Also, the book, Let's Say Doctor, will kind of guide you in that direction. Okay, Doug, we have time to start another one?
We sure do. Let's head to Aptos, California. And Judy, you're on with Dr. Wallach.
Hello, Judy, you're on the air.
Hi, Dr. Wallach. I have a couple of questions. The first is my brother was diagnosed with Graves' disease, and they put him on beta blockers and methimazole. And he called me, and he was interested in trying to deal with this holistically. And so I was hoping you would give me some information about him maybe getting off these things once he starts the program, and why would it come on so quickly?
Okay, now, how much does he weigh?
He's about 200 pounds.
Okay, how tall?
20. He's probably 6'4", 6'5". But he said he's lost weight since he got the Graves' disease.
Okay. And so do they consider him having hyperactive thyroid or underactive thyroid?
Hyper, with an R.
Okay. Hyper.
Yes.
Okay. Yeah. And so basically, the things that cause thyroid disease, whether it's underactive thyroid or hyper, overactive thyroid, always comes down to nutrients. Char, how many nutrients does the thyroid gland need to be healthy?
All 90 essential nutrients.
All 90 essential nutrients. That's exactly right. And what happens a lot of times will be underactive for a long time, and finally the thyroid gland gets crazy and says, I can't stand this anymore. I'm working hard here, but they're not giving me what I need to function properly. So it goes ballistic and goes overactive, hyperactive, and they start losing weight because it's telling you, lose weight, lose weight, lose weight, when it's hyperactive. So we always like to start out at 220 pounds. I go ahead and give him the 90 essential nutrients, something depending on what other symptoms he might have. Does he have any arthritis, any high blood pressure, diabetes, anything like that?
He's had arthritis. He's had asthma in the past. We both got adult onset, in our 50s.
Okay, I'm missing that. You're talking about arthritis for both of you?
Yeah, we had both, we're in the same family, but he developed, he has some arthritis, and he also had some asthma.
Okay, well, Char, you know the answer now. What's the answer?
He's got a gluten intolerance.
Yeah, both brother and sister have gluten intolerance.
Yep.
Okay, and the asthma is a giveaway. And so you got to be gluten-free. That means no fried foods, no processed meats, no oils, no gluten, no wheat, bread, rye, and oats, so it can absorb the nutrients. And hang on, we'll come back and we'll give you the rest of the story on your brother after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Young Judy, Night for Life Crusade. And Doug, let's go right back to California and Judy. Well, this is very simple, and Char's quite correct. Your brother and you, and if you have any other brothers and sisters, and your mom, if she's still alive, everybody has to get on a gluten-free diet. The asthma is kind of the standout there. And then because your brother does have arthritis, anybody in the family with arthritis, so go ahead and give him 2 of the healthy bone and joint packs a month, a full dose of everything twice a day. And I'd go ahead and give him the Immortalium, 2 of those tablets twice a day. That's 2 bottles a month. And also the Ocean's Gold, 3 of those tablets twice a day. That's 2 bottles a month. And then call us every couple of weeks and let us know how he's doing, and we'll walk you guys through this. Okay, Doug, let's see if we can squish in another one here.
All right, let's head to Pennsylvania. And Larry, you're on with Dr. Wallach.
Hello, Larry, you're on the air.
Yes, Dr. Wallach.
Yes, sir.
Thanks for taking my call. You helped me with all my allergies. I've been using your products for about a year. I weigh 164 pounds, and had my prostate removed in 2011. But now they tell me that I have prostatic metastatic cancer in my bones. I got a bone scan yesterday, and I'm taking your healthy brain and heart for 200 pounds. I'll take the glycogel 6 a day. I take the Ultimate Daily for 6 a day. It helped me with my high blood pressure. I don't have that anymore. I take the Selenium 6 a day. I take the Z-Radical 3 capsules of that. I take the Immortalium 4 a day. And I'm off of all wheat and grain. I've been off for a year, but it really got rid of me having to have another sinus operation on my polyps.
Okay, we only have a moment here, so let's get to the prostate cancer thing. And it sounds like you got a pretty good program there, including that Z-Radical. I'd go ahead with 3 ounces of that Z-Radical a day, an ounce for breakfast, lunch, and dinner, and that'll be 3 quarts a month, 3 bottles a month. but keep doing everything else you're doing, including the gluten-free, maximize your absorption. I would also throw in, Char, what is it we have that has a sea cucumber in it?
Ocean's Gold.
Ocean's Gold. She's exactly right. And so I would go ahead and take 3 Ocean's Gold 3 times a day, 3 at breakfast, lunch, and dinner. That's require 3 bottles a month. And the whole idea here is to support your immune system. And the sea cucumber is legendary. The fucoidan, which is in the Z radical, is legendary. The selenium is legendary. And when you look at all the wondrous things that these things do, double-blind studies, both in living humans, laboratory animals, and also human cell cultures that have cancer in it, including prostate cancer. Amazing stuff. Some of the first things on this were actually done and reported in April of 1912. It was reported in the Popular Mechanics magazine because medical journals wouldn't publish it. The same study was rerun by the University of Arizona and reported in 1998 in the Annals of Medicine, which is a very well-respected journal, and got the same results. So selenium, 200 micrograms a day, will reduce the risk of prostate cancer by 69%. And once you have prostate cancer, of course, it's a great support for your immune system. And again, the Ocean's Gold for the sea cucumber and the Z radical for the fucoidan. Legendary. 850 studies on it, and people believe now who are researching this that the reason why the Japanese have significantly lower levels of prostate cancer, breast cancer, stomach and colon cancer than we do is because they eat this red marine algae we call, or it has the active principle in fucoidan. And we get ours from the island of Tasmania off the southeastern shores of Australia, so there's no risk of any radiation from the Fukushima meltdown there from the nuclear power plants in Japan. And so we're very, very proud of these products. And we, recommend them for people with all kinds of degenerative diseases, cancer, lupus, any of these chronic things your body's immune system needs some help with. And so that's where I would go. Give us a call every couple of weeks, anytime you go in for a physical, and we'll certainly help you micromanage this as we go along here. Okay, Doug, how much time we have? Well, that answers that question. Okay, well, thank you, everybody. Really great questions and testimony today. Thank you much, Char. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
We've all heard the term baby boomer referring to those born from 1946 to 1964. There are an estimated 80 million baby boomers, with the first wave hitting the Social Security and Medicare systems in recent years, with more to follow. Many healthcare experts are predicting epidemics of Alzheimer's, type 2 diabetes, heart disease, and cancer among this group. However, these impending epidemics can be averted, as there is a new group emerging. This group we call the baby bloomers, because despite their chronological age, they are still physically fit, active, working, and playing. They've heard Dr. Wallach's message regarding diet, lifestyle, and nutritional supplementation. So while many around them diminish in health and vitality, they are blossoming and blooming into vibrant, healthy, on-the-go people. Wouldn't you rather be a longevity baby bloomer? If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Youngevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.